we will catch them up. So thank you for joining. This is the Olympic Community of Health Change Plan Intermediary Metrics Reporting webinar for integrated implementation partners. So thank you for joining us. My name is Sherry Kushner, and I support data analytics at the OCH. And just a couple of little housekeeping things. I lost my housekeeping slide. Here we go. Since it is just Port Gamble, please go ahead and ask questions using the phone line. You can also type into chat, but it's perfectly fine to go ahead and ask over the line. I am recording the webinar, and most importantly, we are documenting questions that come up and are going to compile all the questions. This is the third of 3 webinars that we will be doing. So we want to make sure that we can get clarifications out. There have been a lot of questions and a lot of requests for clarification, so there will be quite a bit of follow-up from these webinars, and we appreciate your patience on that. Miranda Berger is not able to join me, so I will do her part of the webinar, which is to do a live demo on the ORCA website to show you where you'll be entering your data. So these are the two goals for today: to be familiar with the specifications for the intermediary metrics relevant to your integrated change plan, and to have a demo and understand how you'll enter your data into the online platform called ORCA. So I'm going to start with a brief background on the change plan and where these metrics came from, and then I'll go into some of the specifications. So the Performance Measurement and Evaluation Committee, which Sherston is a member, worked on or was pulled together last August, and in very short order they came together multiple times over a very short amount of several months in the fall to help the OCH with guidance on implementation monitoring, and that takes the form of quantitative metrics, which are called the intermediary metrics. And the real role for this committee is to provide recommendations to the board of directors on things related to data, so assessment and measurement, performance tracking and monitoring. And with the measures for the intermediary measures, it was really to try to figure out some process and intermediary measures that can help to identify and track implementation progress over time, hoping to minimize reporting burden and ultimately to help providers build up capacity for value-based contracting and other kinds of quality improvement and implementation monitoring over time. The PMAC committee worked to develop this set of metrics to guide the work and to guide monitoring towards the OCH performance on what are called the 14 core measures. These were determined by a work group of the OCH board, the Fund Flow Work Group, who convened to help develop the funds allocation methodology for implementation partners for the Medicaid Transformation Project work. And these measures are those that cover the required outcomes within the change plan and are really indicators of implementation of our work. And these are really important as well because the majority of them overlap with the pay for performance measures, to which the OCH is held accountable by the healthcare authority, and our performance, our regional performance on those measures is one mechanism by which the OCH is able to earn funds that are then distributed to implementation partners. So these core measures are in 3 buckets, if you will: integration measures related to mental health and substance use disorder treatment penetration, psychiatric hospital readmissions, and emergency department visits. In the access area, there are child, adolescent, and adult access to primary care services, well-child visits in the first 15 months, well-child visits in the 3rd, 4th, 5th, and 6th years, and utilization of dental services. In value-based contracting, 5 measures that fall within the comprehensive diabetes care suite, controlling high blood pressure, statin therapy for patients with cardiovascular disease, chlamydia screening among young women, and the combination 10 childhood immunizations. The intermediary metrics were subdivided by to crosswalk to the change plan types. So those that were relevant to primary care, mental health, and substance use disorder are the metrics that integrated primary care behavioral health change plan partners will be using. So those are the ones that we will review in this webinar today. So again, the real purpose with these intermediary measures is to understand preceding or predicting those core measures. So really to be able to have an idea of how implementation is going. And again, many of those core measures are also the pay for performance measures that the OCH, through which the OCH is able to earn revenue. And these intermediary measures are to be used for learning, for quality improvement, for monitoring over time. And additionally, the OCH is working on the specifications of how partners will be able to earn funds out of a bonus pool. There is some additional funds that will be generated based on high performance of the OCH or performance above expected performance for our deliverables to the state. And these intermediary metrics will be one element in that algorithm that is yet to be determined of how that bonus pool will be allocated. The intermediary measures will be reported 2 times a year. The first reporting period is, or the first report is due April 12th, and this is to cover the 6-month period of July 1st through December 31st, 2018. And moving forward, the reports will be due in February and August to cover 2 6-month periods, January 1st through June 30th, which would be due in August, July 1st through December 31st, due the following year in February. In alignment with the state healthcare authority pay for performance measure specifications, the OCH is requesting that dually eligible individuals be excluded, that we just be looking at Medicaid only individuals. And unless a measure specifies a certain age group, we would be looking at all ages to be reported. And unless a measure specifies a level of enrollment or a period of duration of enrollment, we would be looking for the measures to include all Medicaid beneficiaries regardless of the length of their Medicaid enrollment. Many of the measures that are within the intermediary metric set are similar to those for which there are national standard definitions, either using HEDIS, HEDIS modified, or National Quality Forum NQF measure specifications. And for some partners, those specifications are already available within their electronic health records, or they have access to those. And if your organization is one of those, it is fine for you to report based on those specifications. And we would just ask that if you are choosing to use those specifications, that you be consistent over time periods, so that your reporting time period over time period would come from the same definition type. So for the reporting, the ORCA platform will have either values that would be just a numerator or a count, or a numerator and a denominator, which ORCA would calculate to a % or rate depending on the metric. And we have 2 special data entry codes for 2 special cases. A code of 8888 would be used if a measure is not applicable to your organization. This would be an indication to us that this is not within the scope of your change plan, and that we would need to turn this measure off for you so that you don't have to see it every reporting period if it's not something that is applicable. A 9999 would be used if this is a measure that is applicable to your organization and your change plan work, but data are not yet available for this. Are there any questions so far?
One theory that is on the bonus tool. There'll be more information forthcoming on that then. We don't know what's guiding that quite yet.
Right, at the board meeting, the board in February approved a preliminary element list, if you will, but there has been no detailed work on how that will be allocated yet. That is forthcoming.
Okay, thank you.
So for the specifications, I'm going to switch to different PowerPoint. All right. So in the integrated primary care change plan, there are 49 intermediary metrics. They fall into different categories: beneficiaries, number of encounters. There are 9 measures within behavioral health, 7 within utilization management, 26 within physical health, 3 within dental health, and 1 for social determinants of health. Last fall, we asked our partners, our primary care or our primary care integrated partners, whether they were receiving reports from their managed care organizations on the national standard, National Quality Forum, or HEDIS specified measures, the ones that are listed here. And our interest was learning whether you preferred to report out or were even able to report out of your EHRs, or whether reporting from your MCO reports was your preference. And for the purposes of the intermediary measures, it would be fine with us if you choose to report out of your EHR, or if you wanted to report out of MCO reports that you receive. If you do choose to use your MCO reports, there are 2 things we want to make sure that you're aware of. One would be that in ORCA, we have only one, you only have the ability to report 1 numerator and 1 denominator for each of these measures. So if you had 3 MCOs and 3 MCO reports, you would need to combine those numerators and denominators to report just 1 time. And then the additional note on this would be that we just want to make sure that the MCO reports that you may be using have the same time period, that 6-month time period that the OCH is using, so that we're looking at data from the same time period. And if you do choose to use MCO reports, or you choose to use your EHR, or depending on the measure, use a different method, we just ask that you report consistently over time, so that when we look at one reporting period next to the next one, that we are using the same report. Oops. Okay, so the beneficiaries served, this measure is across all change plan types, so everyone is reporting on this, and this is also an important part of your funding mechanism, where there are 2 elements in the funding: the scale and scope. So this would represent scale for the physical health change plans. So in the first row, we'd be looking at the number of unduplicated Medicaid beneficiaries who were served during the calendar year. So in your report due in April, this would be for the year 2018. And the second measure would be the number of unduplicated beneficiaries served during the current reporting period. So that would be July 1st through December 31st, 2018. The second measure is for behavioral health encounters. So this measure is relevant to you as an integrated partner and to our behavioral health partners.
I'm sorry, Siri, can I interrupt?
Yes. Sorry, yes. We had you on mute. Yes. So we missed the pause there from the previous slide. But when you said that exclude duals, do you just mean Medicare, Medicaid eligible, or is that also commercial, private insurance, and Medicaid secondary?
Yes, so we had that same question on the last webinar, and we will get a definitive answer on that. When we said dual, we meant Medicaid, Medicare, but we will get a definitive answer on other types as well. Yes, thank you for that.
All right.
So for encounters, we would want the total number of beneficiaries with total number of behavioral health encounters for Medicaid beneficiaries that were completed during your current reporting period. And for this reporting period only, we are asking for an exception, which would be not that 6-month period, but for the entire calendar year 2018. Behavioral health encounters are the scale component of behavioral health partner change plan for the funding model. So in order to determine that piece of payment, we would need to have the total 2018 calendar year behavioral health encounters. Okay, starting with the behavioral health subset measures. The first two are measures that apply to both mental health and to substance use disorder claims. So there are 2 measures for each of these, one specific to mental health, one specific to SUD. So on the top, this would be the unduplicated number of beneficiaries with a submitted claim, either for mental health or the second measure for substance use disorder service. And on the bottom, the measure would be the number of unduplicated beneficiaries who complete at least 1 visit for mental health services or for SUD services during the reporting period. And this would be individuals who had not been seen for that specific service type in the previous 24 months.
Question.
And this is really tribal specific. Most tribal programs will not be submitting any claims to MCO since we bill the IHS encounter rate. We operate outside of the managed care, so I assume that's just to ignore the MCOs. That we would just have claims submitted to Healthcare Authority for Medicaid beneficiaries.
On those top 2, yours goes straight to, where do your claims go? Your claims go straight to the Healthcare Authority?
Yes, we do not submit through managed care organizations. Some tribes probably, they may have opted to contract with MCOs, but the majority of tribal programs don't.
Okay.
And the reason for that is the billing issue. We have to do a wraparound billing, so we have to bill the claim twice if we contract with managed care organizations. Right now, they're not able to pay us the encounter rate. We get a fee-for-service payment and then have to wrap around and bill Healthcare Authority for the remainder. So it's just too much admin overhead for most programs.
Okay. So that might be a case where you would use the 8888 code, indicating that this measure is not applicable to your organization.
Okay.
Mm-hmm.
Thank you.
Okay.
Yes.
The next measure in the behavioral health subset is beneficiaries participating in medication-assisted treatment. This is just a count. So it would be the number of unduplicated beneficiaries who received at least 1 medication-assisted treatment service during the current reporting period. And the next 2 metrics are related to follow-up visits after a psychiatric hospital discharge. And these would be related to, or these are specific to 2 time periods following discharge. The first is a follow-up visit within 30 days of discharge, and the second is within 7 days of discharge. The first measure on this slide is about buprenorphine waivered providers. So the numerator would be the number of providers with a buprenorphine waiver during the current reporting period, and the denominator would be the number of providers in your organization who are eligible to be waivered. And the measure on the bottom of the slide is the unduplicated number of beneficiaries with an opioid use disorder diagnosis who receive a medication-assisted treatment service for that opioid use disorder during this reporting period. The next set of measures are related to utilization, and the first is a measure of high utilization of the emergency department. So this would be the unduplicated number of beneficiaries with more than 5 emergency department visits for any reason during the reporting period. And the denominator would be the total number of beneficiaries who had at least 1 emergency department visit during the reporting period. The next 2 measures are 2 for which we've had several questions. So these are 2 that we will be following up on and will provide some additional guidance. These 2 measures were developed by the PMAC committee to model 2 measures, which are, I'll show you probably on the next slide, which are follow-up after emergency department discharge, and the other 2 are specific to mental illness-related emergency department visits and alcohol and drug dependence-related visits. But these 2 measures differ in that this is for any cause, and we will follow up on additional guidance. There was some concern that there are reasons, appropriate reasons for emergency department visits, which may or may not require a follow-up visit, and that there are different kinds of follow-up, so we need to clarify those. But the intent for these 2 measures is to look at follow-up at 2 different time periods within 30 days and within 7 days of an emergency department visit. And the measures on this slide are those 2 that I just referred to. On the top, it would be follow-up for following an alcohol, drug abuse, or dependence emergency department related visit within either 7 days or within 30 days. And the bottom 2 would be follow-up, again, the same time period, within 30 days or within 7 days, but for an emergency department visit related to mental illness. These measures, these 4 measures fall within our pay for performance measure set. So we will be also providing links to the measure specifications from the Healthcare Authority for these. The next set of measures that I'll talk about are the physical health related measures. These first 3 are for children, and again, these are measures that are within our pay for performance Healthcare Authority measure set and follow national guidelines and for specifications from the National Quality Forum. Those parentheticals are the National Quality Forum references, and again, we will also provide links to the state guidance on specifications for these measures. The first is well child visits in the first 15 months of life. The second is well child visits in the 3rd, 4th, 5th, and 6th years of life. And the measure on the bottom is childhood immunization status. And the specifications are written here. One note, we are working with the vendor for ORCA to update these specifications so that they are consistent with our others, so that they define our population as Medicaid beneficiaries, so that that is very clear. That is our population of interest. These 5 measures on this slide are measures that were developed by the PMAC in an effort to understand and to be in line with the vision around increasing access to care, increasing appropriate care utilization, and increasing linkages and referrals from community partners to clinical partners and between partners in our region. So these are looking at the number of new beneficiaries by age group who come to your organization who were not seen previously in the previous 24 months for your organization. And when we talk about the number of individuals completing a visit, we're interested in visits within the primary care, not for hospital or for emergency department. And the age ranges for these 5 measures. The adult measure, the first one on the slide, is ages 19 and older, and the age groups for youth and children would be ages 12 to 18 years, ages 12 to 24 months, ages 2 through 6, and age 7 through 11 years. The measures on this slide include 1, again, for adults and 4 for youth using those same age ranges. And these measures are looking at utilization of primary care, preventive or ambulatory visits. So again, here we would be looking at unduplicated number of beneficiaries by age group who complete a visit during the reporting period, which for this would be during a 12-month period. And the denominator would be the unduplicated number of beneficiaries in that age range who have an assigned primary care provider within your system. And the 4 measures for youth age groups are also measures that are part of our Healthcare Authority performance pay for performance measure set. These are based on a modification of the national HEDIS measure, so those are specifications that we will share with you. The 5 measures on this slide are the measures that make up the diabetes suite. So these are the measures that we are interested in for our OCH, that are part of our OCH Core 14 measures: diabetes eye exam, hemoglobin testing, poor control of hemoglobin A1C, blood pressure control, and medical attention for nephropathy. These are also measures with national standard specifications. So these, we will also send you links to these. The top 2 measures here, there are 3 measures on this slide. The first 2, again, these are measures that are in our core measure set and are measures that are in our state pay for performance measure set. The first one is statin therapy for adults with cardiovascular disease, and the second is a chlamydia screening test for women ages 16 to 24. And the measure on the bottom of the slide, this is one that the PMEC has included as a measure of access to care, availability of care. It is time to third next available appointment. We have had some questions on this. Kirsten, you provided us with one question, and we're working on some clarifications to this measure. So again, in the question and answer digest that we release, there will be some additional specifications around this measure. There are 4 measures in the PDF that was attached to your calendar invite that are measures that we are having our standalone behavioral health organizations do that you integrated partners do not need to, so those will be removed from your list so that you know. There are 3 measures within the dental subset. The first is the number of your physical health providers or your primary care providers who are trained to perform an oral health screening during a well child visit, with a denominator of the total number of providers who provided well child visits. And Kirsten, you also asked a question of this on a previous webinar, and we will have guidance on that as well. The next 2 measures are about oral health related claims, either for oral exams or for fluoride varnish among Medicaid beneficiaries. Yes.
On the first one, the number of providers trained to perform, does that include medical dental providers like our DHAT and our RDH and our dentists?
So the intent here was around primary care, not dental trained providers.
Okay.
So we will be providing more specific clarifications on providers to answer that very question in the follow-up. Thank you.
Okay.
I don't remember if I did the oral exam and varnish claims measures.
You were right there on that one when I interrupted. Thank you. Sorry.
No, that's fine. So the two on the bottom would be the number of claims submitted for oral exams and the number of claims submitted for fluoride varnish. And the last measure in the measure set is around social determinants of health data. And this measure is set up as a scale between 0 and 4. And a 0 would indicate that your organization does not collect any social determinants of health data. Some examples of what those data might be could be housing status, employment status, something around transportation or food. A 1 would indicate that you collect some kind of social determinant data, but you do not enter it into your electronic health record. A 2 would be that you collect some kind of social determinant data, you enter it into your EHR, but you cannot get it back out. You cannot extract it in a report or registry, for example. A 3 would be that you collect social determinant, you enter it, and you can extract only one type of social determinant element. And a 4 would be that you collect, you can enter, and you can extract more than one of the social determinant elements that you enter into the electronic record. So I'm going to transition to ORCA to let you see how the data will be entered. So you will log in if you are assigned, if you are an assigned change plan user within ORCA, and if there are people in your organization who should have access to your change plan reporting, you can contact Miranda and she will help you to set up that person with access. And you would go in through your NCC just the way you would go into your change plan ordinarily. And similar to the way that you did your reporting for the progress to date, you will now see that there is an intermediary metrics reporting label right here. So you will need to select your organization, and you should only, this is a demo account for Miranda, so we have access to multiple organizations, but you would be able to see just your organization. So let me just find her option. Well, I don't know which one she's supposed to have me use. So when we go into the intermediary metrics reporting, we're going to go ahead and go to the reporting tab and then select enter data. There we go. And now I get to select my organization. So we would not select your organization until you've gone into the intermediary metrics tab. And then we would pick an organization. We don't have all of them listed, so I will just use PCHS as an example. And this is going to be your data entry screen. So again, there's a note here about the code 8888 and the code 9999, just to remind you that those are available and what they mean. And there's also, once we have done more than one reporting period, there would be other reporting periods in here, but for now, our first report is for July through December 2018. And all of your measures will show up like this. You will scroll for them. We're working with the vendor on getting them sorted. Right now, they are not. They are roughly in the order that you have them in your PDF, but not exactly. And you will enter data into the white field. These are some examples of things that Miranda has entered in. The yellow field, these auto-populate your final result by ORCA. So once you have typed in data, for example, a numerator and a denominator, once you type that in and save. I am not going to save, but if we were to save, then it would calculate out the percent for you. So you're not actually calculating the percent, you're not data entering the percent, you're entering the numerator and denominator, and Orca will calculate the percent for you. It's important that you remember to save your data. It won't save automatically. You need to manually make sure that you click save. And we had a question about whether, if there is more than one person with a login in your organization, can you enter data concurrently? And the Orca vendor suggested that that is maybe not a good idea, because it will save whatever is saved by the last person who saved. So it's possible that your data could be lost, your data entry could be lost if someone else is also entering and saving before you are saving. Are there any questions on Orca on the data entry side? This is just all of those metrics.
So when you said concurrently, that would be if we were entering data at the same time, but if we were entering it like different days and saving it, would it show what the other person had entered?
Yes. Yes.
Okay.
Yep. Exactly. Yeah, you just don't want to both be logged in at the same time on two separate computers under your separate logins and enter at the same time. But okay. It is fine for more than one person to go in at a different time and to save their work, and you will be able to both see it.
Thank you.
If you have any questions related to using Orca or are having any trouble with Orca, please reach out to Miranda and she can help you with that and work on finding a solution. There will be, again, follow-up from the webinars in the form of question and answer digest to help with additional resources for the measure specifications. So please pay attention for that to come through. And again, if you have questions or need to ask directly, you're welcome to contact me, contact Miranda, and she can get a hold of me if you have questions on any more data-specific questions. And if there aren't other questions from you, we can go ahead and finish up.
Do you guys have any questions?
No, I think we're done.
I think we're good. Thank you.
Yeah, thank you so much, Siri, for still going through with the webinar with just the three of us here. We really appreciate that.
Well,
thank you so much.
And I can see, I just pulled down my GoToMeeting screen that Mike Maxwell has also joined us. So Mike, if you have any questions, please go ahead and ask. And if not, that's okay too.
We're all clear. We spent a lot of time with a couple of our organizations, and so I'm good.
Okay, thank you so much.
Thank you.
Okay, be on the lookout for a copy of the slides, and in a couple days we'll get those question and answers out. And this is recorded if you need someone else to view it. It will be available as well. And thank you so much for your patience and for your hard work and listening to the webinar today. Have a great day.
Thank you.
Have a good day.
Bye. Bye.